Swadika, it's time now for the midday edition of NBT World Brief right here on NBT and NBT World. You're with me, Kritika Kluat. Many Thais are now registering for the Thais Health Thais Plus 60/40 scheme through the THAILAND application after the government officially opened the system at 6 a.m. today for eligible citizens aged 18 and above who are not state welfare card holders. The Thais Health Thais Plus 60/40 scheme is a co-payment program in which the government covers 60% of eligible expenses, while citizens pay the remaining 40% for food, beverages, goods and services at participating stores. Registration for the public runs from today until May 29, 2026 between 6 a.m. and 10 p.m. or until the 30 million user quota is filled. Eligible participants must be Thai nationals aged 18 and older, not hold state welfare cards and not be suspended from government schemes. Benefits can be used from June 1st to September 30th, 2026 at general stores, blue flag shops, restaurants, street vendors, and public transport services. Food delivery services will join the program from June 15th. Latest figures from the Thais Health Thais Plus website as of late noon today showed over 7 million rice remained available, while nearly 1 million existing merchants had already qualified for the scheme as of 8 a.m. The Thai government has opened registration for merchants joining the Thais Health Thais Plus scheme, aimed at boosting spending nationwide. Deputy Government Spokesperson Lalida Pradviwathana said the government led by Prime Minister and Interior Minister Anutin Chanvirakul has introduced clear application procedures for small businesses and public transport operators joining the Thais Health Thais Plus 60/40 scheme. Merchants previously enrolled in the Kon La Krung Plus program can immediately confirm participation through the Thung Ngeun application until September 30th. For new applicants, they must register with Krung Thai Bank within July 31st, 2026, open a personal account, complete required verification documents, and update the application to the latest version. Approved merchants will receive SMS confirmation and can begin accepting payments from June 1st to September 30th between 6 a.m. and 11 p.m. Eligible participants include food and beverage vendors, community shops, blue flag stores, village funds, public transport operators, and small businesses earning no more than 1.8 million baht annually. Convenience store franchises and agent-based businesses are excluded. The government also confirmed that lottery tickets, alcohol, tobacco, gift cards, and prepaid services are not covered under the scheme. Thailand's Deputy Prime Minister and Foreign Minister is set to attend the United Nations Security Council open debate in New York tomorrow at the invitation of Chinese Foreign Minister Wang Yi, who currently chairs the UNSC for May. Thailand hopes the meeting will help create a positive atmosphere for resolving the Thai-Cambodian border dispute. Deputy Prime Minister and Foreign Minister Sihasak Phongketkaew will travel to New York to participate in the United Nations Security Council open debate tomorrow at UN headquarters. The meeting is being held under the chairmanship of Chinese Foreign Minister Wang Yi, who currently serves as President of the UNSC for May. Thailand is expected to use the forum to present its vision and reaffirm support for a rules-based international system with the United Nations at its core amid growing geopolitical challenges worldwide. During the visit, Deputy Prime Minister and Foreign Minister Sihasak is also scheduled to hold bilateral talks with representatives from several countries, including a meeting with Cambodia's Deputy Prime Minister and Foreign Minister to continue discussions initiated by Thai and Cambodian leaders during talks in the Philippines. Thai officials hope the discussions will help foster a constructive atmosphere for resolving the ongoing Thai-Cambodian border dispute. Despite slowing economic conditions and weaker consumer spending, Thailand's health insurance market continues to grow as more people become concerned about rising medical costs and health risks. President and Chief Executive Officer of Muang Thai Life Insurance, Sara Lamsam, said weaker economic conditions and reduced purchasing power have affected household spending, making life insurance less of a top priority for consumers. However, demand for health insurance continues to rise as consumers increasingly view it as essential protection against higher medical expenses. Many customers, especially those already covered by company welfare programs, are seeking additional insurance plans that offer broader protection at affordable prices. The president added that despite economic fragility, there has not been a worrying level of policy cancellations. Data from the Thai Life Assurance Association also showed that the overall life insurance industry continued to record positive growth in the first quarter of the year. Muang Thai Life Assurance recently launched its new so-called D-Health Lite policy, allowing customers to choose coverage plans and premiums based on their budgets, with maximum coverage of up to 5 million baht per treatment. The company has also upgraded its MTL Health Buddy service to help customers access hospitals and specialist doctors more conveniently. The Disease Control Department says the COVID-19 variant NB181 has become the dominant strain circulating in the country, although there is still no evidence it causes more severe illness. Disease Control Department Director General Dr. Montien Kanasawat said most infections were found among people aged 30 to 35, followed by those over 60 and people aged 20 to 29. So far in 2026, there have been approximately 3,600 cumulative COVID-19 cases and 1 death. Over the past month, case numbers have increased but remain below the 5-year average. Data from the Department of Medical Sciences found that NB181 accounted for nearly 51% of samples collected between January 2025 and April 2026, making it the leading strain in Thailand. The variant is a descendant of the JN1 strain and carries several additional spike protein mutations, which may allow it to spread more easily and better evade immunity. However, officials say there's still no evidence it causes more severe disease. Authorities say COVID-19 in Thailand is now considered an endemic or seasonal disease, but people are still being urged to follow preventive measures. The public is advised to wash hands regularly, wear masks in crowded areas, avoid close contact with people showing respiratory symptoms, and take ATK tests if they develop symptoms such as fever, cough, or a runny nose. High-risk groups, including the elderly and people with underlying health conditions, are being urged to remain especially cautious. And that's the end of our NBT World Brief Midday edition. We see you again in the evening. สวัสดีค่ะ